Good morning, good morning. Happy Thursday. It is a great day to be alive. A little brisk, a little cool, but still a great day to be alive. I want to welcome you to this week's edition of When Life Needs a Detox. My name is Carol White, and I am your life detox strategist. We have a lot to cover today. So we're going to get started right away. And this morning's topic, or this week's topic rather, is racism and the medical profession, unethical post-slavery medical experiments. Now, we have previously spoken about the black slaves being the lab rats for doctors during the antebellum South. Well, the practice of using blacks for experiments did not stop with the abolishment of slavery. On the contrary, it continued into the 20th century. We're going to look at three notable experiments: the Tuskegee Syphilis Experiment, the CDC study of MMR vaccines, and the case of Henrietta Lacks. Excuse me, just 1 minute. That's it, much better. The Tuskegee Syphilis Experiment. This study, which began in 1932, was conducted by the United States Public Health Service for the purpose of observing the natural history of syphilis in the black man. The study was developed after the Oslo study, which was a retrospective look at syphilis in white males based on medical histories of patients. The rationalization of the researchers for allowing syphilis to live, progress, and ravage the bodies of these black men was that these men, they presumed, would never have sought treatment for the disease, so there was no conflict of interest. Let me say this again. Because they rationalized that these men were never going to seek treatment, it was perfectly all right to use them, and there was no conflict of interest. Now, initially, this was supposed to be a 6-month study. This experiment lasted 40 years. 40 years. There were two groups. In the first group, 399 black men diagnosed with latent syphilis. And in the second group, control group, of 201 men who were not affected. In total, 600 black men from Macon County, Alabama, all impoverished sharecroppers, took part in this experiment. I could write an entire book on this experiment alone. So let me just give you the list of atrocities heaped upon these men in the interest of science. These men were promised free medical care, but were given placebos, ineffective methods of treatment, and diagnostic measures as treatment. The men who had syphilis were never told by the researchers that they had syphilis, nor were they told about the effects of the disease, which were blindness, deafness, mental illness, heart disease, bone deterioration, collapse of the nervous system, and death. These men were told that they were being treated for bad blood. Now, that's a colloquialism that was used to describe various conditions such as syphilis, anemia, and fatigue. Now, bad blood, for what we're talking about today, and specifically for the collection of illnesses that the term included, was the leading cause of death within the Southern Black community. The men that were afflicted with syphilis were also never told of the risk of infecting others, their wives, their sexual partners, their children, their unborn babies. Never told. To make certain the men would show up for the spinal taps, which were part of the experiment, but they were painful, they were dangerous, and they were non-therapeutic. The doctors sent out false information letters entitled "Last Chance for Special Free Treatment." After showing up for this treatment, these men were given placebos so the researchers could observe what they called the full long-term progression of this fatal disease. The experiment researchers went to great lengths to make sure their test subjects did not receive treatment for syphilis. In 1934, the researchers provided doctors of Macon County a list of their subjects and asked them not to treat these patients. In 1940, they sent the same list with the same request to the Alabama Health Department. Both times, the requests were honored. Now, during World War II, that's from 1941 to 1945, 250 men from the experiment registered for the draft. And it was at that time they were told that they had syphilis. They were further told to get treatment before they could join the armed services. The Public Health Service researchers made overt attempts to prevent these men from receiving treatment and depriving them of the cure. By 1947, penicillin was the standard cure and therapy for syphilis. The U.S. government sponsored several health programs to eradicate the disease, but the researchers prevented their test subjects from participating in these programs. In 1966, Peter Buxton, a public health services venereal disease investigator, questioned the ethics of continuing the Tuskegee experiment. Now, mind you, it's 1966, but penicillin became the standard cure in 1947. This is 19 years later. Now, the CDC reaffirmed the need to continue the study to completion. And the CDC stands for Centers for Disease Control. And what they meant by continuing the study to completion meant until all the subjects had died and had been autopsied. It was not until 1972 when the story about the Tuskegee experiments broke in the Washington Star and then subsequently the New York Times that a congressional hearing was convened. Now, the panel, after hearing testimonies, came to the conclusion that while the men did agree to certain terms of the experiment, they were never informed of the experiment's true purpose. The final determination was that the experiment was not medically justified, and it was terminated. Now, the second experiment we're going to look at is The CDC study of MMR vaccines. Back in 2014, reports began to surface that the Centers for Disease Control and Prevention were not being honest and forthright in the revealing of their results concerning the measles, mumps, rubella vaccine, the MMR vaccine. There were experts that believed that the vaccine caused an increase in autism, but this was discredited by government officials who stated in a 2004 report that there was, number one, no link between the vaccine and autism, and two, no particular racial group was more at risk than any other. 10 years later, a Dr. William Thompson, who had been with the CDC during that 10-year period, blew the whistle on the project, stating that the authors hid and manipulated the data to hide the fact that this MMR vaccine had a more severe, pronounced effect on Black babies if they received the vaccine before 3 years of age. Black babies taking this vaccine at less than 3 years of age were 3 times more likely to develop regressive autism. Moreover, the parents of these babies were never made aware of the risks to their children developing autism as a result of being given this vaccine. They did this to our babies. The last case I want to discuss today is the case of Henrietta Lacks. Henrietta Lacks cancer cells are credited as the source of the HeLa cell line, one of the most important cell lines in medical research. In fact, it is estimated that researchers have grown or cloned over 20 tons of her cells since the time of her death. Henrietta Lacks went to Johns Hopkins Hospital in Baltimore, Maryland in 1951, where she was diagnosed with cervical cancer. During the biopsy, the doctors noticed that her cells had the ability to stay alive longer than previous cell samples. So they took samples of her cancerous cells and her healthy cells. The issue: at no time was consent given by Henrietta Lacks for these doctors to harvest her cells, nor was any consent given by the family of Henrietta Lacks for the harvesting of these cells. Yet these cells have been used for medical research as well as commercial purposes since this woman's death in 1951. 69 years using this woman's cells for research and commercial purposes, meaning they've made money off of this dead woman. To add insult to injury, the family records were published without the Lacks family consent as well. It seems to me that the medical profession has had a long-standing disdain and disregard for the Black community from slavery up to now. We are still seen by the medical profession as an expendable resource for testing and research. It is for this reason I fear for the Black community amid this COVID-19 vaccine testing that is currently underway. Will we be given full disclosure should we agree to participate? History says No. You know, I know that there are going to be a lot of people that are saying, well, it was in the interest of science. It helped so many people. Why are you upset? Well, let me help you. I will explain why I am upset. You didn't tell, or rather, the medical community did not tell everything that was needed to their experiment participants for them to make an informed, educated choice. It doesn't matter that you don't have formal education. You need to be upfront and honest with people. An experiment that was supposed to have only been 6 months went 40 years because you decided, the medical profession decided, that these men were expendable. We can infect them with this disease, and if you don't cure it, you have infected them. We don't have to cure this disease, but we can watch this disease ravage the body so we can see what it does. The problem is, in the middle of your experiment, a cure came along, but you didn't allow your participants to take advantage of the cure. You deliberately withheld it. That's criminal. You have a vaccine for measles, mumps, and rubella that is causing regressive autism in Black babies 3 times more than any other race. But you don't tell the parents about the hazards. You don't tell them that this could happen to your child. You have a woman who's dying of cancer. You take her cells while she's still living. You don't ask her if she wants to donate these cells. You just take it. But now it was 1951 and you didn't have to care or get the consent of any patient, but especially a Black patient, to take something that was theirs. Because see, this one was still alive. She didn't discard it. You went into her body and removed it. You owed her something. And you've made billions, if not trillions of dollars since 1951. Because these cells didn't stay in the United States. I guarantee you these cells went worldwide. Henrietta Lacks is known all over the world. The HeLa cells is used all over the world. But you did not compensate Henrietta Lacks. You did not compensate her family. We need our medical professionals, but we also need our medical professionals to be upfront, forthright, and honest with us. It is imperative because our lives depend on it. Well, that's all I have for you today. I want to thank you for joining me for this week's episode of When Life Needs a Detox. My name is Carol White. I am your life detox strategist. I love you guys to the moon and back. I want you to stay safe, wear your masks, practice your social distancing, and we will see each other next week. Bye-bye now.